We are delighted to be joined by the wonders of technology by our colleague and our friend Rik Peeperkorn, who, as you know, is the WHO's representative for the Occupied Palestinian Territory. As I understand, Rik, you are briefing us from Gaza, and he will speak about the health situation in Gaza and what the UN team on the ground is doing. So, Rik, please, you have the floor, and then there's some eager people waiting to ask you questions.
Thank you very much. Can you hear me loud and clear?
Perfectly.
Okay, well, first of all, greetings from Gaza. I'm here actually in the WHO office in Deir al-Balah, and I want to update you first on the polio campaign, and then I want to update you a little bit over the general health situation. Well, first of all, a two-round polio vaccination campaign will actually start on the 1st of September in the Gaza Strip. During each round of the campaign, the Palestinian Ministry of Health, in collaboration with WHO, UNICEF, UNRWA, and partners, will provide 2 drops of the novel oral polio vaccine type 2, the so-called NOPV2, to more than 640,000 children under 10 years of age. The Ministry of Health, WHO, UNICEF, and UNRWA, and partners, that we are ready to deliver. Actually, when we speak here down at WHO, there's a so-called Polio Emergency Operations Center, and the technical team is still actually meeting and preparing and planning and how to have the preparation and to complete 1.26 million doses of vaccines. And so 1.26 million doses have already been, they are in Gaza, including 500 vaccine carriers. 400,000 additional vaccine doses will arrive to Gaza soon.
Rik, hold on a second.
Yeah.
Somebody is not muted on this call. If
20 Friday peace agreement ended the troubles in Northern Ireland. The UK government conservatives.
Could I ask the engineers to mute whoever that is? Thank you very much. Rik, if I could ask you just to repeat that last bit, that would be fantastic, and I apologize. Thank you.
Yeah, I'll do so. So the Ministry of Health, WHO, UNICEF, and UNRWA, and partners, actually, we are ready to deliver the campaign. So as we speak in the WHO office, which is the Emergency Operations Center for the polio campaign, the technical team is still meeting now. They're planning, analyzing, etc. 1.26 million doses of vaccines and 500 vaccine carriers have been delivered to Gaza already. 400,000 additional vaccine doses will arrive in Gaza soon. Over 2,180 health workers, community outreach workers have been trained to provide the vaccination, and very important, to inform communities about the campaign. Now, it's critical that we reach 90% vaccination, that we get 90%, 90 vaccination coverage during each round. There will be 2 rounds, and with a split of 4 weeks. That is needed, actually. You need 90% plus to stop the outbreak, the transmission within Gaza, and prevent international spread of polio. What we welcome, we have a preliminary commitment for area-specific humanitarian pauses during the campaign, and we call on all parties to pause, of course, the fighting, to allow children and families to safely access health facilities and community outreach workers to get the children who cannot access health facilities for polio vaccination. So movement of families to the fixed polio points, etc., but also from the team to some outreach for outreach activities. We are, of course, and I want to stress that, without humanitarian pauses, as we call it as the UN, a campaign delivery, which is already implemented in incredible, constrained, complex environments, will not be possible. So I want to continue a little bit in response to this commitment of this area-specific humanitarian pauses. So it has been agreed that the campaign will be delivered in a phased approach over 3 days. So we start the 1st of September, and we start in central Gaza for 3 days, followed by South Gaza, and then followed by the north of Gaza. Due to the insecurity, the damage, the road infrastructure, and population displacement, but also based on our experience with this kind of campaigns globally and worldwide, the 3 days might not be enough to achieve adequate vaccination. So we will monitor it throughout the campaign. It has been agreed when needed, the campaign will be extended by 1 day per zone, or even more when necessary. So 2,180 community workers and health workers support the implementation of the campaign. Security is paramount. We urge all parties to ensure that their protection, as well as of course, all the families and the children who are brought for vaccination, and the health facilities and children. Finally, on this topic, of course, we always reiterate our call for a ceasefire to enable rebuilding the health system and strengthening of routine immunization. Talking about health in general, I think I have to say a few words there. About the health situation in Gaza, we remain deeply concerned. When you look at the hospital functionality, for example, we talk about 17 out of 36 hospitals which are partly functional. We have 58 out of 132 primary healthcare centers partly functional. We have 5 field hospitals in addition, which are partly and fully functional. Al-Aqsa, which is relatively close by where we are now, which was close to one of those evacuation areas, is significantly disrupted by those orders. So from 25 August, 65 patients, for example, they self-evacuated to other facilities. Hospital operates currently on 30% of its staff capacity, providing care to more of 100 admitted patients, including 10 ICU. Another large hospital, which everybody knows, is the European Gaza Hospital. That was 50 days out of services, and currently it's partly a resort to provide some emergency and surgical services. The same, the Nasser Hospital, is close to the evacuation zone, so we are concerned. It's functional. We managed WHO to reach the hospital with medication for cancer patients, hemodialysis, and other medications, and urgent medical disposable. Now, one other point of critical concern is fuel, and I think we have discussed it in all humanitarian areas, but specifically also for health. And in the last 2 weeks, out of 6 missions planned by WHO, only 2 were approved to deliver fuel and medical supplies to the north. So there's a huge problem, specifically in hospitals in north and in the north of Gaza. Al-Ada Hospital, almost out of fuel as of June, but also Kamal Adwan Hospital and Hilu International Hospital. And of course, there's a major effect that if this hospital doesn't get fuel, for example, in Al-Ada, you talk about 15 daily surgeries, you talk about C-sections, you talk about the hospitalized patients, X-rays, sterilization, surgical equipment services, etc. Same applies for Kamal Adwan. The patients in the pediatric, in the neonatal ICU are at immediate risk, including the 23 kidney dialysis patients. I want to leave it there. Over to you.
Thank you very much, Rik. We'll start with Edie Lederer, Associated Press.
Thank you very much, Rik, on behalf of the United Nations Correspondents Association for doing this briefing. A couple of follow-up questions. First, on the humanitarian pauses, who has actually given the okay for these humanitarian pauses? Is it the Israeli military? Is it some of the Hamas fighters or other militants in the areas? And how confident are you that those pauses will be observed? And secondly, about these fuel deliveries to hospitals. You said that in the last 2 weeks, only 2 of 6 missions actually got approved. Were all of those 6 missions to deliver fuel, and were you given any reason of why the others were not approved? Thank you.
Go ahead, Rik. Thank you.
Yeah, thank you very much for these questions. So I mentioned already that the campaigns are planned in close collaboration with the Ministry of Health. The Ministry of Health, UNICEF, so WHO, UNICEF, UNRWA, and partners, etc. So let's say here in Gaza, everyone is on board. We've had these discussions with the Israeli authorities, and that's for us mainly COGAT and CLA. And there where we have agreed to what we call humanitarian pauses. Humanitarian pauses for each zone, 3 days. And based on our assessment and monitoring, when we need another day, we would do another day. Now, you asked me how confident am I in this. I think this is a way forward. I'm not going to say this is the ideal way forward, but this is a workable way forward. Not doing anything would be really bad. We have to stop this transmission in Gaza, and we have to avoid the transmission outside Gaza. And yes, we are confidence is a big word, but we are reasonable, okay with this approach, and everyone is planning accordingly. Of course, all parties will have to stick to this. We have to make sure that every day we can do this campaign in this humanitarian pause. That when needed, we will need an extra day or even maybe an extra 2 days. And we will keep the vaccine, of course, even longer in Gaza. But the issue with this kind of campaign is you want to do it actually as quickly and as intense as possible to make sure you get the highest coverage possible. And yeah, it's an ambitious target, 90%, etc. But the teams here are ready for it. We are ready to go. Now, your other question on the fuel emissions, I said, I think this is not new. And I think this has been mentioned, not just by WHO, by a lot of other partners, that I think even up till now, we struggle with these humanitarian missions to the north or other places. We should not struggle. We are 10, 11 months in this crisis. There should be, of course, a better working deconfliction model and a mechanism which makes sure that we can do this. Very simple, basic missions. I mean, it's as simple. It's what more simple. You bring fuel, you bring medical supplies, you bring an emergency medical team in sometimes, or you help to get an emergency medical team out. And WHO also, we are also sometimes getting, we help with internal transfer of patients from one hospital to another when there's better care. And as you do, we also try to, we also manage and assist with medevac, which is not working. I didn't mention that actually. That's another huge concern for WHO. The medevac before the Rafah crossing was closed. Approximately 4,900 patients were medevaced out of Gaza, 4,900. And with a lot of assistance, WHO and other partners. Since the Rafah crossing closed, the only substantial number of patients which were crossed was actually the WHO and the UAE, very much supported by UAE, and I think we talked about 85 patients. That is the only one since the Rafah crossing closed in 6th of May. WHO estimates that at least 10,000 critical patients need to be medevaced outside Gaza. Half of that probably war-related and trauma-related critical patients, And the other half is, of course, the chronic care patients, and think oncology, cardiovascular, well, all the chronic serious diseases where they need to be referred. And I, again, want to make the point, before this crisis, between 50 to 100 patients per day were referred to East Jerusalem and the West Bank. So what WHO has been requesting for constantly, we need medical corridors. We need a medical corridor to the East Jerusalem and the West Bank, the original and traditional one, to be restored. We need a medical corridor to Egypt to open again, and if needed and possible, to Jordan. Over to you.
Thank you. Michelle,
Thank
and we'll
you.
go down the row.
Thank you so much for the briefing, Rik. Michelle Nichols from Reuters. Sorry to harp on this, but I just want to make sure we get this absolutely clear, because as you can imagine, we get a lot of conflicting messages in this conflict. With regard to the humanitarian pauses, you have an agreement from COGAT that there will be, first of all, a 3-day pause in central Gaza, followed by a 3-day pause in, I think you said south next, and then a 3-day pause in northern Gaza, and COGAT has agreed to that. Is that correct?
Correct. Correct.
Okay, great, because they said yesterday on their Twitter that it would just be part of the regular humanitarian pauses, which I guess up until now have been like 4 hours a day, right?
No, well, in, let's say, the way we discussed and agreed, there will be, the campaign will start on the 1st of September in central Gaza for 3 days. There will be a humanitarian pause during the vaccination on that for 3 days. We will evaluate, discuss every day, assess, etc. When we need another day, it is an agreement that we will get another day. And we might, and we think, based on experiences we have globally with this kind of campaigns, that we will definitely need another day. But that's it. And then indeed, we start in what we call central Gaza, central zone. Then we move to the south, and then we move to the north.
Thank you very much.
Maggie, Amélie, then Ibtissam.
Hi, Rik. It's Margaret Bashir from Voice of America. Thanks for the briefing. Just continuing to follow up on the details of the pauses. So is it 8 hours per day or 24 hours per day during those 3 days? Like, how many hours do you get? And I'm assuming that it's consecutive days, right? You're saying first you go to central, then to south, or are you sending teams simultaneously to central, south, and north? Just to be clear. Thank you.
Yeah. So we plan those campaigns, and from early morning, I mean, like from 6 till 3 p.m. and 2 p.m. We plan 6 p.m. and so the agreement is for these pulses during that period. And yes, it will be consecutive days. So it will be 3 days in the central zone when needed. We added a day. 3 days in the south when needed, we add a day, and 3 days in the north, etc.
Thank you. Amélie, then Ibtissam.
Sorry, hi, I'm Amélie Bottelier from AFP News Agency. Follow up on that. So you expect to finish the campaign in 9 days in minimum, if I understand correctly. So then what would be the next step for the second round? And I mean, all of the UN agencies and the Secretary General said last week that without humanitarian pauses, the campaign will not be effective. So if you don't get these pauses as agreed, how do you expect the campaign to be conducted on the ground?
So you're right. I mean, like that, it's 3 days, 3 days, 3 days, as I explained, and if needed, we add a day. Then normally within 4 weeks, you do the second round. When we start this process, we have to finish this process. So the assumption is for WHO, UNICEF, partners, that we, of course, we will definitely do the second round as well. Now, we need this humanitarian pauses, and that has been very clear. There's an agreement on that, so we expect that all parties will stick to that. Otherwise, indeed, it is actually impossible to do a proper campaign because you will definitely not reach your 90%.
Thank you. Ibtisam?
Thank you. My name is Ibtisam Azim, Al Arab Al Jadid newspaper. Just a quick follow-up on the issue of guarantees and pauses and security. As you know, the WFP car was attacked 2 days ago by the Israeli army. Did you get any guarantees from internationals or any other people that you are not going to be attacked through these supposedly pauses? And then I have a general question about the issue, the humanitarian and the health issues in Gaza. Could you talk more into, you touched a little bit upon it, but could you talk more into other challenges that you are facing, other medical supplies that you need desperately and you are not getting into Gaza? And also, what about other diseases that you are afraid that will be also spread? Thank you.
Okay. Yeah, thank you very much. So, well, first, what you said, you referred to the incidents with the WFP colleagues and the vehicle, which is of course extremely concerning. And I think you should raise this with WFP and I think for respective agencies, and you will get their feedback. We agreed on these pauses. So we expect, and we expect that we will have these pauses. When we have a pause, we have a pause. And the polio workers, the humanitarian workers, the polio workers will be able to do the work. More importantly, the families can move to the polio, so-called polio fixed sites, all the fixed sites, the health facilities, the fixed sites, but I'm talked about that, and they move without fear. Then they bring their children up to 10 years of age. So I think that's I think we yeah. So I don't want to start discussing the assumption. So if that not happens, etc. For me, it will happen and it should happen because we have an agreement. Now, then on your question, I think it's a very good question on other areas. So we discussed mainly I raised this mainly for example, something like these fuel issues. We still struggle to get enough supplies in, and not just medical supplies, many other supplies. I mean, like, as you're aware, so that's one. So we constantly, my team sat, for example, with Nasser Medical Complex just recently, and they have a huge problem with the lack of anesthesia and some surgical supplies, etc. to get in. And we have these, but it is often difficult, slow to get them in. And in general, I think when you talk about the health situation and health functionality, what I described, I mean, like that, less than 50% of the hospitals is partly functional, and even less than that primary healthcare centers. I mean, that says enough. What we, of course, also see, and that's you talked about other diseases. We've seen enormous amounts of infectious diseases. We see more than 110,000 cases of hepatitis A, which is all linked to the incredibly poor water and sanitation conditions combined with the heat. We've seen more than 500,000 diarrheal diseases cases, if I'm right on that figure, and which at least 25 times as high as what it normally would be, even higher. And those are underreported cases. We see a lot of scabies, skin diseases, etc., etc. It's all related to the poor sanitation. And we see now polio. So I think it says enough. I mean, like specifically with the water and sanitation condition and the water supply, which is incredibly poor and challenging and a huge issue. I understand from colleagues, for example, not only on when you talk about water, that there's a huge shortage in chlorine. I mean, like in Gaza. So those simple but critical items for to help improve a water and sanitation situation is not only needed. So yeah, there's a lot of that. And also concerns, because normally primary healthcare is the backbone of any health system. Well, less than half the primary healthcare services are actually functional. And for a lot of people, they're difficult to reach. So there's a lot of under-reporting. And we talk about that Gaza had a relatively okay functional health system. For example, we talked about antenatal care, mother and child health, etc. It was relatively well organized. Well, all those areas are challenged. Everywhere there is challenges. So not just infectious diseases, basic mother and child health, and definitely, and then on top of this, of course, what we discussed today, polio. Over to you.
Thank you. Tony, Benno, and Pam.
Thank you. Tony Naddaf, Al Hurra TV. You mentioned 1.26 million doses are already in Gaza. You can correct me if I'm wrong. My question is, where do they come from? If you can specify exactly the source for us. And also my second question, how informed are the people in Gaza about this campaign, about the importance of this campaign? We all know like Gazans are struggling to find food to eat. So how confident are you that they're gonna be responsive, they're gonna engage, are they gonna, prioritize getting a dose or a shot for this polio?
Okay, so there is, we talk about a novel oral polio vaccine, so-called NOPV2. There's, to my knowledge, 2 production sites for that, Indonesia and India. And and they are indeed in Gaza. Now, how far are we with community? So we just, they are, of course, all WHO qualified vaccines, by the way. I just don't want to go there, but it's, and you ask me, I think that's a really good question. Like, what about community and how well is the community informed? So we just got this agreement for this campaign, and as we described, this we will start on the 1st of September in the central Gaza, then we move to 3 days, possibly +1, then to the south, the similar, and then to the north. Now, together with the whole team, Ministry of Health, WHO, UNICEF, UNRWA, and partners, that's exactly what they are working, not just on the sites, not just on the cold chain, not just on that, but also indeed, like, what is the communication to the communities? So that is ongoing. They already have been informed, but now we can really very clearly brief them when and how, and we will do that, of course, very specific per zone. So that is an ongoing process, and I think there's a lot of experience in that, in communication on polio and risk communication, although this is an incredibly challenging environment, etc. An ongoing process.
Thank you. Pam, Ephraim, and then Bassam, and then Deji.
Thank you, Rick. It's Pamela Fogg from U.S. News and World Report. My question is a follow-up on the 1.26 million doses that came in. COGAT announced that it went across the Kerem Shalom crossing. What percentage of overall vaccines that you assess and UNICEF assesses are needed? What percentage is that, the 1.26 million doses? How much do you need overall? Will that do it? And how is the COGAT coordination with WHO and UNICEF going? Do they help with the distribution? And how is it getting out to other parts of the country? Thanks.
Yeah, so of course we are definitely we are convinced that we will have enough doses. Actually, we always will order more because of some doses might be wasted. It will, there's always spillage when you do this kind of vaccine campaign. So there's probably, and that's why also we get 400,000 doses more in. So it will be more than 1.6 million. So you talk about 640,000 children. So you can do the math, etc. We will have enough vaccine in Gaza. Yeah, including what is normally you always have to plan for additional doses because everywhere you will have spillage. I hope I was clear on that one.
Thank you so much. Given that the circumstances that led to the re-emergence of polio are still pretty much in place, as you just explained in details as well, from the poor sanitation, lack of water, people living in open sewage, even drinking from the sewage we're seeing. I'm sorry about this question, but how effective would just a vaccine be alone in how effective will the vaccine be to tackle polio? Is there anything else needed? I don't know if this question makes any sense, but one cannot help but wonder.
Definitely. I think it's a very good question. It makes a lot of sense to me, at least. So, first of all, we know that with this type of polio outbreaks, I mean, from the circulated vaccine-derived polio virus type 2, that you will need to vaccinate at least 90% of children to stop the transmission. And that's where we are so focused on. So if we under-vaccinate, we are not stopping the transmission. So we are really focused. But I think your question is completely right. So what more to do? A lot should be done. So we already, I mean, like since this crisis, war, whatever you call it, started, of course, and you saw a disintegration of the health services in Gaza. Also the surveillance system for diseases, including for polio, disintegrated. The routine immunization system, weekends, disintegrated, really went down. So together with partners, etc., we are focusing on improved surveillance system, which we, of course, that's why also this case was discovered. I mean, after the sewers, the samples, the environmental samples proved positive, etc. So we are focusing on improved surveillance. But definitely WHO, UNICEF, and partners, we have to double our efforts to improve routine immunization. And continue that. Routine immunization will be key. Finally, of course, it's when you talk about water and sanitation and everything around, you talk about much more complex areas and basic health services, primary health care. And I know we probably sound like a broken record, and for that, to improve that, you need to massively step up the humanitarian assistance. And of course, you want to do that you can move around. So finally, we all hope that we get a ceasefire arrangement and a ceasefire process. So the vaccination coverage, I just want to make the point in Gaza. In 2022, there was a coverage over 95% in Gaza, higher than a lot of surrounding countries, actually higher than a lot of European countries, a lot of high-income countries. And that dropped a bit in 2023 to 85%. Still, I would say pretty good coverage, etc. Now, in the first quarter of this year, and I think I really want to credit the health workers, all the health workers which are focusing on that, together with support from UNICEF, WHO, all the other partners, the NGO partners, the EMTs, etc. The coverage for routine immunization was close to actually 90%. Now, we have to examine that more better because, of course, we struggle with some of the data currently in Gaza. But there's a lot of attention currently about the health workers, WHO, UNICEF, and partners to help and strengthen not just primary health care, but as part of primary health care, of course, routine immunization. Over to you.
Thank you, Wissam.
Bisana Bukwek with Al Jazeera Arabic. I just wanted to follow up on Tony's question about reaching out to the local community. I mean, what kind of message are you sending out to make people feel that it's worth it to reach you to get this vaccine safely without actually risking their lives? If you can elaborate a little bit more on that. And then you mentioned that the 3 days is extendable by 1 day or 2 days in the different areas, and the threshold is a 90% success. If you don't reach the 90% success, even after an extension, what would be the plan B?
Okay, so on communication, I think one thing, I mean, I already informed you that the acceptance for vaccines in Gaza, by the way, also in the West Bank, is really high. So we have seen successive coverage, years of coverage of over 90%, 95%, 96, 97%, which is really high. I mean, like, which is much higher than a lot of high-income countries. So the acceptance for vaccine is high. So people are very well informed what happens in Gaza and the reasons also why this is happening. So we expect that, yeah, the vaccine acceptance in Gaza is high and will be high. So we expect a massive pour out of people and family to bring their children and to get vaccinated. We need those days. We need those days, the 3 days, and most likely +1. But we will, of course, make assessments, continued assessment. This is all very well monitored. Now, and that's why, of course, we have this agreement on this, what we call a humanitarian pause, etc., and that should be implemented. Then I think we can reach a huge number of kids and we can come close. When we wouldn't come close, so we will daily monitor that, there is mobile teams who reach out to areas which remain, what we would say, under-vaccinated. So it's a combination. People will go to all those fixed points, and if we see, hey, there's areas where vaccination should be higher, etc., they will be specifically targeted by these mobile teams to reach out. And then last, even if we would think that the coverage is too low after this campaign, we will continue to inform the communities and make sure the vaccine is available in health facilities close by, and we keep on vaccinating kids. So we will have to do, we'll constantly, and this is what you do, by the way, normally with polio campaigns, and I've been working for 7.5 years as a WHO rep in Afghanistan. We went through multiple campaigns here, also under difficult circumstances, but this is extreme, what we have here. And you constantly will have to adapt and retarget and analyze and reassess, etc. We have a lot of people with, well, I would say real polio experts now in Gaza. UNICEF, WHO got some additional experts in, etc. And we will constantly make those analyses, and if needed, adapt our approach. Over to you.
Yes, a week ago, Israeli ambassador here said Israel is going to cooperate with WHO, with UNICEF, but without UNRWA. You just mentioned that UNRWA is part of this campaign, vaccine campaign. Have you encountered any difficulties when communicating UNRWA's participation in this campaign with Israeli authority? And also, I just want to ask, would there be any problems with evacuation orders, or have you got any promise from Israeli part that there wouldn't be any evacuation orders during the campaign? Thank you.
Yeah, good question. No, we haven't encountered any problems. Actually, UNRWA was part of the discussions, even when we had discussions with COGAT. So no, that's very clear. It's part of the plan. And also using, of course, this as UNRWA primary healthcare facilities, and we have to use all the points. On your second point, actually very good point. I said, yeah, there's be an agreement that there will not be evacuation orders during those campaign days.
Yeah, thanks. Just wanted to ask you, as far as you know, does Israel have any cases of polio?
And I didn't get your question.
As far as you know, does Israel have any cases of polio yet?
No, I mean, and I wouldn't know. The Ministry of Health in Israel would not know, but no.
And can you just describe what a humanitarian pause actually means? Is it just total no fighting, or what does that really mean? Thanks.
The humanitarian pause means that during the hours of the campaign, yeah, and that is from 6 to 2 to 3, there will be a what we call a humanitarian pause. So families should be able to bring their children, should be able to move around. More also equally important, the almost 2,500 health workers and community volunteers, etc., will be able to move around as well. So that is and of course they are. When we start in the central zone, we focus on the central zone. And then we shift to the southern zone, and then we shift to the north. Are there any more questions? Sorry.
Yeah, sorry. Kristen from Al Jazeera here. So it sounds like you're saying that after 2 or 3 p.m. in the afternoon, that pause may not be in effect. How will that impact Palestinians who are trying to get to these locations? If it's not a full 24-hour pause, are you concerned about that? And also, I'm wondering, there's an estimated 615,000 children in Gaza. Have there been any vaccinations taking place this year so far, or do you assume that all of them are behind on their vaccines, and you're going after all of them just in case? If you could clarify, thank you.
Yeah, I think your question on am I concerned? So this is of course part of the communication as well, which we will do with all the communities, and we focus on the timing of the campaigns. So and also what I want to stress is this ideal? No, it's not ideal. Can we? Absolutely not. Can we work with it? I think we can work with it, and we will push, and we will manage. We will try to manage to work with that. We have to be very clear on in the communication, which we will be. Now, did we raise the concerns? Of course, we raised the concerns. That's it's. And you ask what is the impact? And of course, we raised the concerns in our discussions that. It will not be very helpful that after after the campaign period there will be suddenly an incident or something like that, and we requested as well that will not happen and should not happen, so that we indeed build that trust even bigger, that people know. But I think if we are clear enough, and normally, by the way, in campaigns, when you do campaigns. People come in the morning, in the early morning, and this is, of course, what we are going to focus on. Now, you ask about other vaccinations, and I try to explain that. So, in Gaza, the routine immunization has always been actually one of their success stories in Gaza. And by the way, also in the West Bank, when you talk about public health program, high coverage rates and very high acceptance of vaccines, all children vaccines. So no issue there. And of course, when this crisis further erupted and this war further expanded, not only the health system, but also the public health systems suffered tremendously, including routine immunization. And this is something not just WHO, UNICEF, all the partners, of course, focused on how can we restore routine immunization. And that is continuing and that is ongoing. And I said the last results from the last quarter was actually pretty, was I think promising that almost 90% of the children were covered through routine immunization. We have to triple check the data, which is more complex now. I mean, on the denominator issue, etc., which is of course in a war situation that is much more difficult and much more complex. But there is a high acceptability for vaccination in Gaza. People know and understand why the children should be vaccinated, and they will come with their children. So yes, vaccination has been ongoing, has suffered, just like surveillance and in general public health intelligence, etc. And we are all working on that to help strengthen and expand that. But that is complex in a war situation. Over to you.
Thank you. We'll go to Abdelhamid on screen and then Arul.
Thank you, sir, and thank you for the briefing. Abdelhamid Sayam from the Arabic daily Al-Quds Al-Arabi. I hope you will come to brief us more often because the health situation in Gaza is as dire as you know. Many of my questions were asked, but I have a few others. First, polio has disappeared from Gaza 25 years ago, so it's coming back. Could you shed some light about the root causes of this and other diseases that my colleagues ask about? And if you have plans for like vaccination of measles or smallpox or other diseases that is in the pipeline now in Gaza. And the second, there are health problems that cannot be addressed through vaccination, like malnutrition. Can you shed some light on this issue of malnutrition, especially among children? And lastly, sir, do you have, WHO, do you have any unit that deals with the psychological effect on children? And how do you deal with that for a whole population had been for 11 months under continuous attacks in a genocidal war that is unprecedented in modern history? Thank you very much.
Yeah, I'll try to, because you raised a lot of, I think, complex questions. So we talk about and what we say, circulating vaccine-derived polio vaccine type 2, which came into Gaza, and which came actually into Gaza from Egypt, from the Sinai area. Now, why did it become a problem in Gaza? And you see this in many places where you get vaccine-derived poliovirus giving polio cases. You get that in an environment where children are under-vaccinated. And in Gaza, children were never under-vaccinated. Because of the crisis, war, a group of children now is under-vaccinated. And this is why we are concerned, very concerned, and this is why there is this risk that more children, will get polio. Now, we have an approach for that. We have an approach for wild poliovirus, we have an approach for vaccine-derived poliovirus, etc., with this novel oral polio vaccine type 2. We need to reach huge coverage, and this is again said, if you don't reach enough coverage, etc., the problem will not go away. And this happens in some places around the world. I mean, it's not just happening in Gaza, and my colleagues who are better polio experts can explain it even better, but it's always in areas where there is conflict, strife, war, where you see an under-vaccinated child population. And that's the case here as well. Now, you asked about other diseases, and I think and I think I want to maybe start with and by the way, just to say on the first half, even under these difficult circumstances in the first half of 2024, almost 22,000 children actually received routine polio vaccination. So the health workers, an enormous credit to them in this incredibly absurd, challenging Gaza circumstances together with WHO, UNICEF, and partners, etc. They're focusing on that. You raised a number of things. I want to start with the last point you raised, mental health. And I think I completely agree with you when you talk about mental health and psychosocial support. So before this crisis war, Gaza was relatively already, there were a lot of people affected with mental health problems. Based on our assessment and survey, there was almost 450,000 people, which is a lot for a population of 2.2 million. Again, you see this also in other places. I worked in Afghanistan, when we had all this strife. We had a similar situation and a similar problem, relatively in a high part of the population. Children, women, adolescents, men, etc., affected by mental health more than what you would see in a peaceful environment, etc. Now that's okay. Now what happens now, and I completely agree with you, everyone is affected. And this is my fifth or sixth visit to Gaza. The first visit was in late November, and I stayed then in December. I came back in February for a number of weeks, in April, in June, and July, and now. And every one every Gazan, everyone, of course, is mentally affected by what's happening and what people are going through. And I completely agree. There is already work going on by health partners, health workers. I want to mention also UNICEF, but also other partners, WHO. We're working already, try to address that. It's very difficult in these circumstances. We have to focus on what we call special needs group, and children, of course, is definitely a focus. But I want to make a point. We have to focus on children, but you also have to focus on the special needs population. You have to focus on adolescents. You have to focus on women, on men, and also old people and elderly. I've seen enormous, also among elderly, everyone. And I think we have to approach that. And whenever there is a ceasefire arrangement and we can expand this. And I want to also make the point that before this crisis, there was a number of Gazan NGOs that did a lot of good work, community outreach on mental health. But much more needs to be done. So with WHO, we try to integrate mental health in basic health services, in primary health care, but it's a complex in many places, in many countries, which is much too often mental health is hospitalized and focused on special mental health hospitals. It should go back to the community approaches, etc. But we really have to rethink our whole approach onto mental health whenever also there's a ceasefire and ceasefire arrangements, and to approach this in a different way. So thank you very much for raising this, because I think it's completely an underestimated problem. It's a big focus in the WHO current humanitarian health approach and plan, but it is even having a bigger place in our what we call early recovery, rehabilitation, and reconstruction if we get to that phase. But I'm afraid we have to completely do it differently. You ask about malnutrition and other areas. I think I want to make the point that in Gaza, and I've been here so often and so many times over the last 3-4 years, malnutrition was never an issue. You talked about 0.2, 0.3% of children being malnourished. What was an issue was micronutrient deficiency. For example, iron deficiency, etc., which needed to be addressed. So too much anemia, etc., especially among pregnant women and sometimes girls and children. But malnutrition was never an issue. And what we have seen, and specifically, of course, I recall rightly in January, February, March, we saw a substantial increase in malnutrition also among children, and specifically in the north of Gaza, but also in the south. Kamal at one, like the WHO, UNICEF helped with a couple of these, what we call the treatment support centers for malnutrition, and doing that. And I've seen a lot of malnourished kids, and I remember that one of the pediatricians in the north told me that when I say, hey, is it true that the trend is seems to go down a little bit. This was in April, in May, that he said, yeah, he also thought the trend was going down a little bit, but he said, please note, we've seen hundreds of kids which were malnourished. It's difficult to put a real estimate on it. What is a problem, I think, is the lack of diversified food, the lack of healthy diets, and the lack of healthy diets, I think, in all of Gaza. Even if something is a lack of cash for people actually to purchase those foods, etc. So that is a problem which we have to focus on. Now you mentioned, I think I already mentioned other diseases, other infectious diseases, which we have seen a massive expansion in my earlier replies, etc. Not just diarrheal diseases, acute respiratory infections, hepatitis A, skin diseases, scabies, etc. And of course, a lot related to the incredibly poor water sanitation conditions, etc. I think what is critical important that we further strengthen primary health care, because that's, of course, finally the basis of all health services and where you could treat a lot. But finally, it's about prevention. It's prevention of water and sanitation. And if you see the living conditions, and now just because today I came in again and with a colleague who is coming here regularly, and we see constantly these changes when there's evacuation orders, people have to move, people have to cramp into another place, etc. And if you to take these coastal roads and this endless row of ad hoc makeshift tents and camps, etc. I mean, that even in the official areas where people stay, water and sanitation is really poor and an enormous problem. Well, definitely in all those makeshift sites. Over to you.
Thank you, sir.
Arul, please go ahead.
Arul Lewis from Indonesian News Service. I have a couple of questions for you. One is, who's the manufacturer of the polio vaccines that you're getting? And also, if the country or the company is donating them or you're purchasing them. And you mentioned in the passing about India's participation. Could you please elaborate on that? Thank you.
No, I said something different. I said the novel oral polio vaccine is actually is produced, to my knowledge, in 2 sites, in Indonesia, and I think there's also now a site in India. What we have in Gaza comes from in Indonesia. I want to make also a point, because I think I've seen some pieces and in the newspapers and other things. So maybe let me also say something about that. This novel oral poliovirus 2 is safe, effective, offers protections against paralysis and community transmission. It's the vaccine which is globally recommended for variant type 2 polio outbreaks. And this type has been identified and found in the recent samples from Gaza. Now, since the rollout of this novel oral poliovirus type 2 began in March 2021, more than 1.2 billion doses of vaccines have been used to protect children in over 40 countries against type variant poliovirus in Asia, in Africa, in the Middle East, etc. So only in what's for WHO is our region, the Eastern Mediterranean region, around 65 million NOPV doses have been given to children as early as August 2024. And in all kind of places, I mean, like in places close by, Djibouti, Egypt, Somalia, Sudan, Yemen, etc. But also, many of the African countries, etc. The development of the vaccine began in 2011, and in December 2023, following completion of a full clinical trial program, the NOPV2 became fully licensed and was granted WHO pre-qualification. Over to you.
Thank you. Margaret Bashir, and then we will close it off.
Thank you, Rik, for indulging me a second time. Just a couple of mop-up questions. So if you get your first dose on September 1st, when do you get your second dose? Is it 2 weeks in between, or could you just give us an idea when the second round will start, in other words? How many fixed healthcare sites will there be for families to go to? And finally, I'm just going to push you a little on this pause. How many hours per day? You said 6 a.m. to 2 or 3 p.m. So do you mean at 2 p.m. the vaccinations stop and then people have an hour to get home or to their shelter in safety? Or just be a little more precise for us. Sorry, it's just such a sensitive story. Thank you.
Yeah. So the first question is actually simple. So that is 4 weeks. Normally 4 weeks. After the first round, you do the second round. On the number of sites, I have to get into let me think, because I had it somewhere, the number of sites. Just give me 1 second. We talk about, I already said, we talk about 2,180 health workers and community outreach workers we trained. And we talk about at least over a couple of hundred sites. I mean, like that. So I have to get back. I mean, I had that somewhere. I cannot find it now. I'm apologize for that. Maybe I will reach out if you stay online. We reach out to our colleagues.
Yeah, you could pass the information to me, and I'll be doing the briefing, so we can share it along.
Okay, and again, on the humanitarian pauses, etc. They're what we see as pauses. They are for 8 hours, and well, we take them from 6 in the morning to 3. But at that, we want to make sure that vaccinations take place, for example, between 6 and 12 or 6 and 1. So indeed that everybody can move. But of course, what we hope and what we expect that not anything will happen after that time. I think we want to make sure that we have 3 days of the best access possible, that families bring their children to all those fixed sites where families cannot bring their children. We will go out and we target that with the mobile teams. And we do that in 3 consecutive days. Every day there is an analysis. And by the way, this works everywhere around the world. And that's one of the really strong sides of a polio eradication initiative, etc. I mean, it's a lot of experience how to do that. And every time to analyze, like, okay, which areas we didn't do so well and which areas actually we did well, which areas we have to spend more time the next day, which areas should be specifically targeted by mobile teams, etc. If I get the number of sites, I will get back to you, and then I will get it as well.
Okay, go ahead.
Thank you, Rik. You said that the humanitarian pause is 8 hours, and 6 a.m. to 3 p.m. is 9 hours. How's that going to work?
Well, for us it is actually, and that was, I think, the final agreement. It was from 6 till 3, and we will focus on that. But I want to make that point very serious. Normally, when you do these campaigns everywhere, and I've been involved in quite a few, so we have clearly made that 9 hours, yeah, and that is for us the agreement. But I want to make that point very clearly. Even if we would not be in such a complex situation, you would normally do this vaccination between 6, actually with daylight started. People rise very early till noon or 1 o'clock, something like that. And after that, very little happens. So we will make sure that we communicate that also very, very clearly. We hope, of course, there will be that the humanitarian pauses will last, etc., and that it will all help to create a conducive environment that we can expand this vaccination as good as possible, and that indeed we reach 90% plus. And we will make every effort. We will make every effort to reach that targets. And I heard some of your questions. I think they were very, very good. And of course, we're looking into that. If in areas we wouldn't reach their targets, how do we approach it? Can we send mobile teams? Can we resend mobile teams? We will have what we do now as well. We have missions. We continue to do missions. We will keep the vaccine longer here, etc. I think that is it for me. Oh, I think I just get some information on this. Wait a second, please. Hang on. The micro plan is actually, this is exactly, now I know it again. So with polio, we talk about micro plan. And micro planning, that sounds easy, like, oh, but it's actually very complex. Because in many places, I want to say you go out you actually do house-to-house campaigns. Unfortunately, in Gaza, that's not feasible. So that's why we have 392 sites, fixed sites, and we have 295, almost 300 mobile teams. And we'll use them, of course, the mobile teams, we will use them everywhere, and we start with the central zone, then we shift to the south, the southern zone, and then we shift to the northern zone. So we talk again, 392 fixed sites and almost 300 mobile teams. And again, when needed, we will constantly make adaptations when feasible.
Are those fixed sites only in the central area, or is that all over Gaza?
No, that is all over Gaza. So it's a combination from existing hospitals, existing primary healthcare facilities, but also there's a lot of what we call medical points, for example, which were established to deliver field hospitals, and a huge number of additional sites, an enormous number of additional sites, because we talked about 16 of the 36 hospitals only to be, which are only functional, and what is it, 50 of the 150 primary healthcare centers. So an enormous number of additional fixed sites have been established, and almost 300 mobile teams already. This is for all Gaza. But of course, especially the mobile teams, we'll concentrate that. When we start in the central zones, then most of the mobile teams will be operational there. Then we will shift to the southern zone, and then we shift to the north.
All right, Rik, thank you very, very much. You've been very generous with your time. We wish you and your colleagues the best of luck in your great efforts to do what you can. Thank you very much.
Thank you very much, Stefan. Thank you very much, all of you, for the questions. If there's any additional questions or in future, etc., please reach out to us.
There will be additional questions. That much I can promise. Thank you.
Bye-bye.
Take care. Bye-bye.
Take care.
All right. Thank you for your patience. I have a few